So Monty, you want to start with presidentials? You want to come out hot and heavy? We got a couple more big presentations in prostate.
Gosh, we could, although I have very little insight in that particular disease group, and in clinical practice, I see almost none. But, I will say that, as folks have seen based on the posted presidential sessions, again, more data for, theranostics in this space. It's going to be pretty exciting to see that move forward. So maybe I'll kind of leave it at that for prostate cancer. That's about the extent of my knowledge there.
No, I think, and Chris, want to get your take on some of this, but I think the PSMA addition, we had this trial at our center, and having standard of care, adding lutetium-based therapy, much like what we expect when we see a first-line bladder in the future with HER2 and other type of features we might want to know. This MCSPC space where we might want to know HRR alteration already up front, we might want to know their PSMA PET uptakes. It's going to make that housing and triaging of how we get MCSPC patients into clinics and pick these rational treatments really interesting. Chris, I wonder your take on that as a urologist, and then maybe just if you're excited about anything in the high-risk localized or BCR setting.
Yeah, I think, in the theranostics, there's obviously two big ones. We're talking about MCSPC and PSMA addition. We can't forget about the Canadian CCTG, PR21, and MCRPC, so we'll loop back there. But, I think we've gotten to a point where an ADT and ARPI doublet is kind of the go-to default for most MCSPC patients. We think about, amplitude data at ASCO last year and the role of a PARP in the HR mutant populations, and then this is going to give us data for potentially using lutetium in the PSMA positive. I mean, I think if we look at VISION or PSMA4, we're going to think that a large proportion of patients should be PSMA positive in MCSPC. We haven't been doing in clinical practice routine PSMA PETs, at least for me, I haven't, if they're conventional imaging positive in this space. So it's interesting to even tease out what subset of the patient population is going to be eligible here.